As work furloughs continue to hit homes, especially right here in Las Vegas, Southwest Medical wants to ensure health care is not a worry for older adults. Rocky spoke with them to find out more.
Dr. Alamo, it's good to see you again.
Nice to see you again. Thank you for having me.
So we're talking about work furloughs and Medicare. Obviously, this is a really rough time for a lot of people, a lot of senior citizens and older adults in Southern Nevada.
Absolutely. And this is a phenomenon that's happening across the country. But here in Southern Nevada, it's hit extremely hard. At its peak, we had a 30% unemployment rate. It might be at 25 right now. It's not very good. But when this occurs, obviously, these elderly, 65 and older, lose their group insurance. And they have a couple options. They can try to COBRA, which is extremely expensive. They revert back to a Medicare fee-for-service that's also expensive. But then they have 60 days where they can jump into what's called a Medicare Advantage program.
Wow, so they got to get on it very quickly. And what are the coverages and qualifying events other than losing their job?
Well, yeah, that's the big one, obviously, right? The one that's triggering all this conversation is losing their jobs. But there are other qualifying events. Moving out of a service plan, moving in and out of the country. Let's say you move in and out of institutions like a nursing home, you come back to the house. So those kind of things, there's financial needs as well, can cause that. But those, let's bookmark those, because the one that's striking right now is the loss of employment. And it's affecting the elderly in a very big way.
And what happens when you're getting Medicare and leaving your group insurance?
Well, what happens is again, you've got to have choices. Once the group insurance leaves you, because that's what happened when you got furloughed, you can continue in that plan, but it's expensive, or immediately flip into fee-for-service Medicare. The situation there is this is an expense they've never seen before. Right. Now the husband and wife, there's an 80-20 potential, so you can get maybe a supplement, which you have to pay for as well. There's pharmacy benefits, which you have to pay for as well. And what it covers is less than what you were used to when you were with group. Hence the reason why the Medicare Advantage is a direction they should consider.
For sure. And what about those costs for Medicare and Medicare Advantage? Yeah,
they can be very burdensome. Again, a person who's been working and had group insurance was used to not having any cost or very minimal. Right. Now, overnight, you end up having a situation where 20% you're responsible for, there's a deductible, and to try to combat that, you try to get supplements. Well, these supplements can be expensive, and you're paying for yourself and your spouse, and what could happen here is you got to get a D pharmacy plan as well. But you're also losing benefits. Vision is not included, rides aren't included, so the things that you enjoyed in group are gone. Medicare Advantage fills those voids.
For more information, call 702-242-7119 to speak to an agent or visit smalv.com. Southwest Medical has locations across Southern Nevada. Kendall?